Absolutely. So MDA's conference that we convene every year in March of this upcoming year in Orlando, Florida, really is one of the very best opportunities for stakeholders across the spectrum of the neuromuscular disease community to come together and discuss some of the challenges ongoing right now in front of those who live with neuromuscular diseases, those who care for and treat those with neuromuscular diseases, and really any other allied professional or any other stakeholder in the area. So one stakeholder group that we're always excited to convene at our conference is our Neuromuscular Advocacy Collaborative, or NMAC for short. And the Neuromuscular Advocacy Collaborative is made up of about 25 to 30 or so advocacy organizations that also advocate for those with neuromuscular conditions, oftentimes a single neuromuscular disease. And oftentimes these organizations, while serving their community, are seeking ways to collaborate with other neuromuscular disease organizations, such as ourselves, but such as the other organizations in the space, to collaborate on public policy and advocacy. Because when you have 25 and 30 voices together advocating for a policy change, advocating for a new program, advocating for whatever it happens to be, it's going to be so much more effective than just one voice calling for that. So each March, when we convene the Neuromuscular Advocacy Collaborative, and we're very grateful to have many of the organizations attending in person at our conference, and then we have other organizations who attend virtually. We come together and first discuss what are those most important issues that we're hearing from our community, from each of the specific communities or the community more broadly, of challenges that they're facing in their everyday life, and how could we collectively translate that into effective public policy making. So we're really looking forward to our March conversation to kind of kick off the ensuing 12 months at the very least of active collaboration between the organizations in the space, really making change for those we collectively serve. There are a number of stakeholders and a number of challenges that our community faces that do need to be brought up more, perhaps, than they are being brought up right now, certainly in the broader conversation of our healthcare ecosystem. In many ways, the good news is that in 2023, it's been a record year of the number of new therapies that have been approved by the Food and Drug Administration to actually reach those with neuromuscular conditions. We've had several approvals in Duchenne muscular dystrophy, one in actually two in amyotrophic lateral sclerosis, and additionally other approvals in some other neuromuscular conditions. And so consequently, with these FDA approvals, we have new offerings on the market for those with neuromuscular diseases to potentially try out these new treatments. But access challenges really are accelerating in how often we hear about them and how often the community may be experiencing them. These are utilization management techniques, oftentimes used by insurers. These are formulary changes that actually exclude some neuromuscular disease treatments. And so something that we think needs to be talked about more often is the other side of the coin of this innovation that we're seeing, of new approved therapies from biotechnology companies getting these approved by the FDA, but then from there, all of the access challenges that still stand in front of our community actually obtaining these therapies. So that's something that we at the Muscular Dystrophy Association are certainly trying to tackle. We're doing this on Capitol Hill. We're doing this with the Centers for Medicare and Medicaid Services. We're doing this with a variety of other decision makers and stakeholder groups. But again, this is an area in which no one neuromuscular disease community really is facing this uniquely. This is something that many different communities face collectively. And consequently, that's an excellent way in which the Neuromuscular Advocacy Collaborative can come together to try to tackle these systemic issues and actually increase access to neuromuscular disease treatments across the entire community. Well, with this upcoming year, we're seeing all the greater importance of cross-stakeholder collaboration. As I mentioned a handful of times already with our Neuromuscular Advocacy Collaborative, that's the convening of the patient organizations, the advocacy organizations in the space. What the conference also allows us to do is convene with the clinicians, those who are diagnosing those with neuromuscular diseases, those who are then prescribing new treatments. And oftentimes, as we're convening with them, whether it be in a convening of our care center directors, or perhaps those more focused on gene therapies, or even just within the conference sessions themselves, as these care center directors, these clinicians, these allied health professionals are talking about the barriers they've experienced in getting the community the care that they need, we then are able to not only, of course, discuss those barriers with these care professionals within this venue, but then also actually translate that into public policy making. To give you an example, actually from this previous year, the 2023 MDA conference, there was a specific emphasis on access to palliative care within the neuromuscular disease community. And at the time, really, our advocacy team wasn't actually particularly engaged in trying to accelerate access to palliative care. But since then, and seeing the emphasis that we saw within the clinical community placing on palliative care, we've since actually worked with a number of other organizations on increasing access to palliative care for those with neuromuscular diseases. Ever since we were able to hear that emphasis from the clinical community at our previous conference that occurred in Dallas of 2023. So consequently, the conference is a launching pad for so many different initiatives, whether they be within our neuromuscular advocacy collaborative, whether they be within the clinical community working with the patient community, the research community working with the patient community. So those 4 days or so that we're all gathered together are so invaluable across the entire year for launching so many new initiatives and collaborations, and I'm really looking forward to it.